Hello, my name is Olivia Kumi. This recording will propose an evidence-based care plan that I believe will improve the safety and outcomes of the patient in the case study presented. In this video, the patient is a 70-year-old male with the diagnosis of COPD, living in a rural area with limited access to specialized pulmonary care. He suffers from chronic symptoms such as constant cough, difficulty breathing, and recurrent respiratory infections. Patients with chronic respiratory failure, particularly those living in rural or remote areas, often face significant barriers in accessing specialized care. According to Stephenson, rural areas have a higher prevalence of COPD compared to urban areas, particularly in economically disadvantaged communities with limited access to health care and health education. The prevalence of COPD is nearly twice as high in rural areas, 8.2%, as in their urban counterparts, 4.7%. Attending frequent hospital appointments can be challenging due to physical limitations, the need to transport medical equipment in long distances. This becomes even more difficult when patients require care from multiple medical specialties, as seeing different specialists may require multiple trips to various healthcare facilities. Geographical isolation exacerbates these issues, leading to delayed or limited access to essential care. Additionally, caregivers often struggle with providing adequate care at home without immediate access to specialized support. Telemedicine offers a valuable solution by bridging the gap, allowing healthcare professionals from various specialties to remotely monitor and guide the patient, providing more coordinated, accessible, and timely care without the need for frequent travel. In this collaborative process, the primary care nurse, Sarah, leads a remote team of healthcare professionals, including a pulmonologist, a respiratory therapist, and a pharmacist, to develop a comprehensive evidence-based care plan for managing the patient's COPD. During a virtual meeting, Sarah presents the patient's symptoms and medical history, emphasizing the need for a detailed treatment plan. The pulmonologist reviews the patient's medical records and pulmonary function test results, agreeing with Sarah's assessment and recommending bronchodilator therapy, including long-acting beta agonists and inhaled corticosteroids, to improve lung function and alleviate symptoms. The respiratory therapist shares insights from remote pulmonary rehabilitation sessions, highlighting significant improvements in the patient's exercise tolerance and overall quality of care. Additionally, the pharmacist reviews the patient's medications, ensuring that there are no harmful interactions, and stresses the importance of educating the patient and their family on proper inhaler use and medication adherence. Sarah listens to the team's input, incorporating their recommendations into the care plan and committing to regular virtual follow-up visits. These follow-ups will allow the team to monitor the patient's progress and make necessary adjustments to the treatment and provide continuous support. This proposed care plan emphasizes patient empowerment, self-management, and leveraging technology to manage COPD in a rural setting. It includes evidence-based interventions for medication management, lifestyle changes, and education while considering the barriers of living in a rural area with limited access to health care. Regular follow-up, use of remote monitoring tools, and community supports are crucial components of this plan. To create a comprehensive care plan for a COPD patient using the knowledge to action framework, is important to start with identifying the knowledge base, evidence-based guidelines, and emphasize key interventions for COPD. This particular patient is a 70-year-old male with moderate COPD, a history of smoking, and limited mobility, living in a rural area with minimal access to healthcare resources. Available resources should include medications such as long-acting bronchodilators, inhaled corticosteroids, and rescue inhalers, as well as remote health tools like telemedicine consultations and home monitoring options. Given this patient's location, referral to a virtual pulmonary rehabilitation program and exploring options for home care services are essential. Assessing barriers and facilitators to knowledge uses Assessing barriers include the patient's limited mobility, financial constraints, and the challenge of accessing healthcare services in a rural area. By leveraging telemedicine, home monitoring devices, and online resources, we can ensure consistent care and follow up regardless of the patient's location. The next step is to select, tailor, and implement these interventions. For patient education and self-management, providing clear information about the COPD progression and how lifestyle choices could impact symptoms is essential. Written materials and videos are helpful, especially when access to in-person resources is limited. Encouraging smoking cessation is a key, as quitting smoking is the most effective way to slow disease progression. Breathing exercises refer to various techniques designated to enhance the depth of inspiration or expiration, or modify the rate, pattern, or rhythm of breathing. Common examples include muscle training, expiratory muscle training, diaphragmatic breathing, and other combined exercises. Inspiratory muscle training, for instance, helps slow the decline of lung function by strengthening and improving the endurance of the inspiratory muscles, which alleviates dyspnea and enhances the patient's quality of life. In terms of pharmacological management, inhaled bronchodilators play a key role in managing symptoms and are typically used to regularly prevent or alleviate symptoms. The regular and as needed use of short-acting beta agonists and short-acting help improve breathing and reduce symptoms. Combining these medications can enhance lung function and alleviate symptoms. Long-acting beta agonists enhance lung function, reduce breathlessness, improve health status, and lower exacerbation rates. If the patient experiences frequent exacerbations, inhaled corticosteroids may also be indicated. Short-acting beta antagonists, such as albuterol, should be provided for acute symptom relief. If the patient's oxygen levels are low, home oxygen therapy should be prescribed, as studies have shown an improved survival in hypoxic COPD patients. Maintaining physical activity and pulmonary rehabilitation is critical for COPD management. The patient should be encouraged to engage in low-intensity exercises such as walking, strength training, or yoga to maintain mobility and prevent physical deconditioning. If local services are unavailable, virtual pulmonary programs should be recommended. Proper nutrition and hydration play an important role in managing COPD. The patient should be provided with dietary advice based on their weight status. For those underweight, a high-calorie, protein-rich diet is recommended, with a balanced diet rich in fruits, vegetables, and lean proteins, which are essential for maintaining healthy weight. Adequate hydration is necessary to help thin mucus and ease breathing. So advising the patient to drink at least 6 to 8 cups of water daily is important. A consultation from a nutritionist could be beneficial for this patient. Psychological support is often necessary for patients with COPD, as this condition can lead to anxiety and depression. Encouraging the patient to engage with local or online support groups for people with COPD can help them share experiences and coping strategies. In addition, identifying community and social resources is essential for ensuring comprehensive care. Local support groups, wellness checks, and home care services should be explored. Transportation may be a barrier for this patient, so investigating options like ride-sharing programs or mobile health units is important to facilitate medical visits. Finally, advanced care planning should be a part of the patient's overall care plan. As COPD progresses, the patient may benefit from palliative care to manage symptoms and improve quality of life. Discussions around advanced directives, including end-of-life care, should be initiated when appropriate. These discussions ensure that the patient's wishes are respected as their condition advances. By implementing the KTA framework, this comprehensive care plan integrates the latest evidence-based knowledge with tailored interventions that account for the patient's specific resources, needs, and barriers. Regular monitoring, education, and support are central to empowering the patient in managing their COPD, ultimately improving both their physical and psychological well-being.